Can you get rid of hooded eyelids? Aging around the eyes is something that everyone wants to avoid. You don't want to age around your eyes. It makes you look tired, sometimes it makes you look angry, and it makes you look like you've aged. What causes hooded eyelids? Aging in the eyelids can take place in many forms. It can be hyper squeezing, squinting, and frowning of the muscles around the eyes. It can be from descent of the eyebrow. It can be from redundant and excess skin in the upper eyelids, and it can be redundant skin in the eyes or redundant fat in the eyes, causing bulging of the eye fat and a circle where the depression is below the eye fat. Now, the first thing is to diagnose the individual to give them the best surgery, procedure, or combination thereof to make it look the best. Some patients that think I've got hooded eyelids, it's actually that their brows are down and we need to do a brow lift and a little surgery on their eyelids. So let's talk about a couple of nomenclature things. Upper eyelid aging can come from a few different reasons. One is the skin can become redundant, excessive. We've got too much upper eyelid skin and it looks heavy on the eye. For that, a simple removal of eyelid skin and upper eyelid blepharoplasty works very well. If that is associated with brow drooping, which makes the redundant skin look worse, we often have to do a brow fixing or slight lifting of often the lateral brow to make the eyelid look better. So sometimes I will combine a brow lift and upper eyelid surgery. Additionally, what can happen is the hooded eyelid can be caused by weakening of the muscle so that the eyelid has fallen down on the eyeball. It's ptotic. That's P-T-O-T-I-C, ptosis. The ptotic eyelid covers the eye more than looks good. For that, we like to do a small surgery to lift up the eyelid margin and tighten the eyelid muscles. How can I tighten the skin on my upper eyelids? So eyelid surgery can involve removal of skin, removal or transfer of a little bit of fat. I try not to take too much fat out of upper eyelids because I think that ages the eyelid. And it can involve tightening or shortening the muscle to lift the level of the eyelid. Any of those things can be done. And lastly, the muscles around the eye can be hyperdynamic, hyperfunctional, and we may need botulinum toxin, Botox, in those areas to weaken the squeeze of the muscles. How much does an eyelid lift cost? It really depends on what we're going to do. Simple eyelid surgery in my practice is about $4,700. But I'm often doing it with brow lifting, which costs more. I'm often doing it with botulinum toxin, which costs a little bit more. And I'm often doing it with something in the lower eyelids, which we have to also consider. So I think the individualized consultation decides what we need to do to get you what you want. Nobody needs this. They usually want it. It will let you see better and it will let you look your best and your most refreshed. The consultation will tell us what to do, and then that might dictate what the cost will be for this. I'd love to see you in my office. I'd love to tell you what I think is making you look more aged than you'd like. For instance, I operated yesterday on somebody who I did a rhinoplasty on and wanted her upper eyelids to look better. She had no redundant skin, she had no brow ptosis, but she had primary ptosis of the upper eyelid. Her upper eyelid was very droopy. Before I did her rhinoplasty, I did a small surgery on her upper eyelid that lifted the level of her eyelids. And I think she's going to look a lot better, a lot more refreshed, even though she's only 26. She'll look less tired, she'll look more refreshed. So the individualized consultation is the most important thing. I'd love to see you in consultation. Come in, make an appointment with me. I'd love to talk to you, examine you, and make a suggestion of what will work the best for your face. Thanks a lot.